If you've got knee osteoarthritis and you're looking for some pain relief, you've got to try these 3 different treatment techniques. I'm a physical therapist that's been working on patients for the last decade, and I found some things that work really, really well, things that you can do from home. So let's dig into it and get started. The warm-up that I first want you guys to do is just some simple heel slides to get that knee moving. So what you're going to do is you're going to lie down on a firm surface on the floor or on your bed, and you're just going to start moving that leg back and forth. I want you to do this 30 times and just get that knee used to moving through the greatest range of motion that you possibly can. Once you've done that, go ahead and relax, and let's dig into the fun treatments. What you're gonna do next is you're gonna take a butter knife, or you can get one of these tools on Amazon. I'll provide a link in the description below. And you're gonna scrape right over that same area that you just cupped. So on the inside of your knee, on the top of your knee, and on the outside of your knee. And you want that lotion on there so there's not any friction and you don't over irritate that area. But ultimately, take that butter knife or the scraping tool. You're going to turn it at a 45-degree angle, just like this, and then you're going to go right over that joint line. It shouldn't feel great, but it should only be like a 3 or 4 out of 10 in terms of pain. And the faster you go, the more it's going to numb the nerve receptors, and the less it's going to cause you a lot of discomfort. So I'm going to do this for about 30 seconds. I'm just going to go back and forth. And what I'm going to notice is there's a good amount of color change in that area. It's going to be more red. And we like that because that tells us there's more blood flow in that area, and blood carries oxygen and different nutrients. So I'm going to do 30 seconds there. I'm going to come up over the top of my knee, just right where I cupped. And I'm going to do the same thing. I'm going to rotate it about a 45-degree angle. Nice and quick movements, just trying to dig into that tissue a little bit. I'm just going back and forth. I'm going to do that for 30 to 45 seconds. And then I'm going to go on the outside of my knee. I'm going to do the same thing, just going back and forth for about 30 to 45 seconds. Now, it might feel a little gritty and it might be a little uncomfortable. That's totally normal. What we're looking for is more blood flow in that area, so then that pain calms down. So in a very effective way to get more blood flow and more mobility into your knee joint is through something called cupping. Now, you can buy a cupping set off of Amazon. I'll provide some links in the description below for about $20 to $30. And it works extremely well at bringing in more blood circulation and more mobility into that knee joint. So I'm going to walk you guys exactly through how to do this on your own from home to get some relief through that knee joint. So what you're going to do is you're going to take some lotion. I use cocoa butter, and you're going to put it around your knee joint on the outside and on the knee joint on the inside. Now, I know for a lot of people, cupping sounds crazy, but man, it works really well. You don't want to use it on any open wounds. Obviously, if you've got a blood condition, you don't want to be doing this either, but it's really safe and it can give you a lot of relief. So I apply a lotion right at the top, on the side, and on the inside of the knee joint, okay? Now what I'm going to do is your cupping set will come with a little gun like this, and you're going to put it on the top of your knee, right above your kneecap, and you're going to pump it up just 2 or 3 times. Then you're going to put it on the inside of that knee joint. You're going to pump it up 2 or 3 times. Just get a nice little suction there. It shouldn't feel good. You should feel a lot of pressure in that area. That's the whole idea. And then we're going to see if we can get this to suction on the outside. If for some reason that the cup won't suction, it's because you don't have enough fatty tissue in that area. And it means you just got skinny knees and you just got to get a smaller cup. But if you can see now, I've got 3 cups on there, and they're starting to change color already. Now, I don't leave these on there for more than 2 minutes, but what I want to do now that the cups are on there and there's a good amount of suction and pressure is I want to start moving that leg back and forth. So I'm just kicking my leg up and down. This does not feel good, okay? It is not meant to feel good at all. Just keep that in mind. Now you're going to kick back and forth for about a minute to a minute and a half, and then if you can tolerate it, try standing up and just walking around a little bit. You can even do small little miniature squats. The idea is movement while the cups are on there. This helps break up adhesions throughout the tissue and draw in more blood flow so you get better movement through that knee. So don't leave them on there for more than 2 minutes. And if they start to change colors really quick, then you just want to take them off. If you notice, there's a nice little purple tint to these, and that tells me that I'm already getting some good movement and breaking up some good adhesions throughout this area. So they're going to start popping off on their own, or you just pull up this tab and it'll come off just like that. And when you start moving that leg around again after you take them off, it's going to feel really, really good. So that's the first little treatment technique that I strongly suggest that you guys do. And now I'm going to show you guys how to scrape your knee. Now, you shouldn't be doing any of these really aggressive techniques like cupping or scraping if you're on blood thinners without medical supervision. If you've got any open wounds in that area, you wouldn't want to do this. But naturally, if you've got a healthy knee, you don't have any blood conditions, this is a great way to loosen up that knee and get things moving again. So after you've done the scraping, after you've done the cupping, keep in mind I like doing the cupping first and then the scraping. But after you've done those, go back to doing the heel slides, because you're going to notice, one, that your knee's moving a lot better already, and two, it's going to help getting that circulation going in your knee again. So you're just lying back down on your back and just going back and forth. You're going to do that 30 times through the greatest range of motion that you can. And let me know in the comment section below if that's really helped you out with your knee pain. And we'll see you guys next time.